Hey, it's Kelly with your A1 Extra presented by New Hearing Center. This week, Herald Courier's David McGee has a preview of his upcoming story on the effects of long-haul COVID. Here's David.
One of the topics that I typically cover has been COVID-19 and the impacts of the pandemic. This Sunday, I'm doing a feature on a nurse practitioner who contracted COVID back in the end of 2020. And she and her husband both got it. Other family members also got it. All were hospitalized. Her husband passed away, unfortunately. She survived, but she has suffered the effects of long-haul COVID going on 16 months now since her initial diagnosis. She has dealt with fatigue. She has dealt with brain fog. She has dealt with phantom odors and other symptoms that are very typical for long-haul COVID. And in the process of investigating the story and doing the research, found out that a tremendous number of patients who had COVID suffer long-term symptoms. For some, it's a few weeks or maybe a couple of months, like as in this case with Dr. Sharp. She is well over a year and a half, going on 2 years now, and is still suffering some of the impacts of the disease. The other part of the package is we're talking to Ballad Health, which is the local healthcare provider, and talking about they have a long-haul COVID clinic where they are treating patients with some of these various symptoms, and they have a large number of patients that are involved in treatment that have, again, months after they initially had the virus, recovered from the virus, but still have some of the symptoms.
All right, that's it for this week's A1 Extra. Make sure you visit HeraldCourier.com for more stories and reporting of Bristol and Southwest Virginia. And remember to follow along on Instagram and Twitter at Herald Courier. We'll see you next week for another A1 Extra, brought to you by New Hearing Center.